Okay, are we ready to go, you guys? Just show of hands, who knows Alex Haddad? A few of you. I think he's been gone from Canada. Maybe you can tell us, Alex, 3 or 4 years. Can we put Alex up? All right, we really wanted him here in person. He can decide if he wants to explain why he's not here in person. Alex is a Colombian Canadian scientist, philosopher, magician, add more. He can tell you more about his career arc. You guys know the Center for Digital Therapeutics at UHN, a few of our fellows. Alex is the OG founder of that. And my favorite thing about Alex, you guys, he's the first physician to send a patient an email. In the 80s, he almost got excommunicated from the world for doing that. It was unheard of to send a patient an email. So he's been digital in his mindset before any of us used the word. So he's now evolved a lot, and he's done a couple great writings on humans and AI. And I thought, after the last publication, I thought this was a special way to end our 2 days together. So Alex, over to you.
Thank you very much. And hello, everyone. I hope you can hear me well.
Yes.
Wonderful. So thank you for those kind words. And thank you for the opportunity to be here with you all today, because this will be an invitation for us as leaders to pay attention to something that we tend to take for granted. And that's what could be called the in-between, and to do it together and in the most interactive possible way. So I would be inviting you to pay attention specifically to that squiggly that appears there right in the middle of the title, which is called an ampersand, And this symbol was considered about 200 years ago to be the 27th letter of the alphabet, a letter. Okay? And it's called ampersand because it is like a double and. It's and per se and ampersand. And we have been using it for over 2,000 years. The Romans invented it because scribes 2,000 years ago, instead of writing et, as you can see right at the beginning, they started connecting these two letters, and over time, it became that squiggly that we use now, that we have on top, usually of the 7 on our keyboards, and we tend to call it and, but it's much more than and. This is a symbol. Remember, it was considered the 27th letter of the alphabet that really binds things. It's a super and. It's something that tells us that those two things or more are almost a unity. It's like in Ben and Jerry's, the ice cream. Okay? It's one entity. And it has legal implications. When you see and, this ampersand, which is not and, is an ampersand, that means there is a very strong bond there. So this evolution of this symbol that represents what makes the in-between so special will be a major theme today. Because we tend to think of the world, our organizations, our communities as networks, and we tend to pay a lot of attention to the nodes of that network and tend to undervalue or almost ignore the connections between the nodes. So again, today will be an invitation to go to that in-between space together and figure out the importance or the important elements of that space for us as leaders. And my hypothesis is that there, in that space, is where we will likely find our meaning and our purpose and the main value we can offer society in this very peculiar time in which we find ourselves. Because some people tend to think that we are going through a period, through an era of changes. I would like to argue that we are going through a change of era, and leadership will be more important than ever. And just as the ampersand evolved over 2,000 years, our relationship with technology has been evolving for hundreds of thousands of years. And this cartoon illustrates that in a way. So technology has been conceptualized as anything that we humans use to achieve a goal, to make a difference, to influence our environment. So even the very first rock that we shaped and that we used to break a nut was already probably the or one of the earliest forms of technology. And we have been using technology, again, obviously, for hundreds of thousands of years. But now we are facing for the first time what you have heard many times over the last 2 days and throughout the last at least couple of years, that for the first time ever, we have technologies that can think and that can reason and that can talk back to us and think with us and do things on their own. So this situation in which we find ourselves now is inviting us as leaders to think about that space in between, about that bond that has existed with technology since we became Homo sapiens sapiens, and to reflect upon the implications of having now this incredibly special type of creature in the world that is much more than the dumb tools that we used to use for the rest of our history. So I would like to emphasize that and a super and that is binding us to this technology we called AI, which could be artificial intelligence or augmented intelligence, or we might even find a different term very soon because it's clearly inadequate, and see how we can make the most of the challenges and opportunities that this new relationship that is emerging can offer for us as leaders, and at the same time, how can that relationship enable us to offer as much value to those that we are meant to serve. So how can we spend some time today just looking at how these complex bounds that are being formed between us and these new tools are going to change everything, and how our role as leaders would need to change. And you have heard a lot about that in the last couple of days and in the last few months, I'm sure. But today, I would like to invite us to switch into first person singular and first person plural for a few minutes. And this is where we are going to start using the Mentimeter today to look at how this new relationship might start looking like when we start reflecting upon ourselves as a species that managed to nurture, to give birth to creatures that could be as intelligent, if not more intelligent, than their creators. So I would like now to invite us to switch to the Mentimeter and in one word, try to capture what aspect of humanity you think must be protected at all costs, given the opportunities and challenges that the AI is creating right now. What do you think about that?
Okay, Alex. I don't know if can you see the results, Alex, that are coming?
I can see the results that are coming.
We're coming in. Has everyone got the Mentimeter going? I don't because I'm on 3G. I got to go get some internet. You can put more words, like go twice.
Yeah. Okay, so it seems to be growing still.
Okay, Alex, we switched off the Mentimeter.
Okay, so let's leave it on the screen. Let's go back to the Mentimeter. And we have microphones in the room. It would be interesting to have a feeling for what that word cloud triggers in us. What jumps to us? What is tickling our souls from that word cloud?
Okay, anyone's soul being tickled that they want to share? Here's Vanessa. Introduce yourself.
Hi, my name is Vanessa Wright. I am a nurse practitioner and AMS fellow. What really jumps out at me is a small word at the bottom, which is the value of struggle. And my BFF here, Marisol, just told me she put that. So.
Okay, would you like to talk about it a little bit, please? What did it do, and what motivated the contribution of that word?
I guess I need to contextualize a bit because, I'm from Mexico and I was raised in deeply indigenous values. And for us, the value of the struggle has a lot to do with the capacity of feeling joy. So that is something that I have been witnessing in my own research, because I do work on trust building frameworks, co-designing trust building frameworks with underserved communities here in Canada. And that comes over and over again in terms of how the root of that distrust, of that like not trusting the technology, is precisely that elders, people don't see the struggle in it. They don't see the human factor, the human, fight into getting to understand things. And that eliminates a potential joy opportunity.
Okay, thank you. And what motivated the person who contributed that word? It would be great to know.
That was her.
Okay, that was you.
That was Marisol, yep.
Wonderful. And I think what you're saying, struggle is a verb too, to struggle. Okay, we can have struggle as a noun. And I would like to emphasize the fact that links, what happens in between, tends to be verbs. So to struggle, very interesting. Any other words that tickled your soul? And I can see, for example, unusual words there like love. You see, we tend not to put love obviously in front of us. Why love?
Who else wrote love? It's right in the middle.
It's
Helen.
right in the middle, yes.
Hi, Alex. It's Helen Angus. Nice to see you.
Hey.
Hi. I actually thought of love as sexual desire because I thought, if we don't have that, we don't have more people.
Wonderful.
Right?
There you go.
And we're done.
Okay, so we're maintaining the species. Okay.
Tina, just let me comment on this one, Sena, just for a second. And Ellen, wonderful to see you. Love has also been conceptualized in terms of 4 verbs. To wish good, and all of them have to do with goodness, by the way. To wish good, to do good, to see good, and to feel good, you see. And so from what you said, the preservation of the species has a lot of goodness if we are kind to other life forms, including these AIs. So I would qualify it because now it could be argued that life on Earth could be better off without humanity. We haven't been good stewards of this planet so far. Compassion, which I know is very, very important to this academy and to this group. If we need to protect it at all costs, we might have an opportunity to see how compassionate we are as leaders, really, or as humans in general, and whether that is being eroded or whether that is being protected as much as we think we should protect it. And would anyone like to comment about that?
I think we're good, Alex. We've been talking about compassion a lot.
I know, and I'm sure. This is why I'm glad to see it there. It checks. So just one last question. When you think about protecting at all costs these elements that appear on the cloud, raise your hand if that protection you feel looking at the cloud refers more to the individual level, like the one-to-one relationship that you have as leaders with others. Raise your hand if that's the case, or if it is more at the organizational level that we need to protect these elements of humanity, or at the system level, or all of three, all the three of them.
Okay, let's start with who thinks this. You're feeling this on an individual level. Raise your hands. I would say so. Okay. And then either keep them up. No, put them down. And then how about at the, who is thinking organizational level? So the first was about a third, Alex. The second, I'd say 20%. Who is feeling this is a system level we must protect at all costs?
Okay.
About half. And who was automatically all three? About half.
Okay, wonderful. Okay, so I'm going to now move on. This is, I think, a good way to get a little bit of clarity on what I would like to share with you as a spectrum of positions that are now presented to us as a response to the emergence of AI in our lives. And this spectrum requires to keep in mind all those things that we consider so valuable that we should protect at all costs about humanity, because those are the very issues that are more at risk or most at risk from what's happening with these intelligent creatures that we have enabled to emerge. So this spectrum, and by the way, you are the first group that publicly sees this framework, has at the two ends what could be called purity. On the one hand, pure human activities where AI is not needed at all, and in fact could be detrimental. And at the other end of the spectrum, we have what could be called pure AI, where humans are not needed. And in fact, if humans participate in that, the outcome would be worse off than if we were left out of the equation. So keep in mind this as a spectrum, because in the immediate adjacent areas, we have what is borrowing from mythology. On the one hand, we have the centaur position, where humans dominate the relationship with AIs supporting, just like the centaur that had the head and the upper part as human and the bottom as an animal. And on the other side, we have what's called the minotaur, where the head is not human and humans are playing more a supporting role. This notion of the centaur emerged when Kasparov found that he couldn't beat a machine, and he said, what would happen if humans and machines joined forces, my hypothesis, he said, would be that we would be better than machines alone or humans alone. And he thought that that was going to happen with chess. If we fast forward, it happened for a while, but now machines alone are better at playing chess than if there is participation of humans. So chess has moved all the way to the right. And if you get humans joining forces with machines, they are defeated by other machines. So the Minotaur is now becoming very, very relevant in the military world because more and more machines are making decisions. And we can see that now pretty much live with very little human input or humans just authorizing a particular action, and the decision has pretty much been made by a non-human agent. So we are now feeling a tension between the human side and the non-human side, and because of a lot of commercial and political pressures, I would argue that the influence and the power across these possibilities is shifting to the right. And that is putting at danger our humanity, the role that we as humans have, and it's calling upon us as leaders to figure out ways in which we could achieve as much balance as possible. And then right in the middle, we have what I think might be the most exciting source of opportunities for us, which is where human and non-human advanced intelligences operate as co-equals within a context of genuine partnership. And I'm going to be using the spectrum to illustrate the role of that super and in terms of what's happening, and to invite us to think about the implications for leadership. So on the pure human end of the spectrum, that super and is emphasizing that we should not have AIs as part of the picture. And similarly, at the other end of the spectrum, the ampersand, which is and per se and, that's what ampersand means, indicates that we should keep humans away from that end, because if we get them, the outcomes will not be as good. There are examples that are starting to emerge from this within healthcare and at the intersection of healthcare and leadership. This is a headline from just a few weeks ago from Mitchell Katz, who is the leader, the CEO of perhaps the largest hospital system in New York City. And he stood up in front of an audience, and this is an article that is worth checking. He said, I would replace most of my radiologists now if I could. And I cannot, not because I believe that machines could be doing a similar or better job, or because that would be the right thing to do. It's because of regulatory barriers. But if I didn't have regulatory barriers, I would replace most of them. I would have replaced them by now. And then he adds a twist to his interview. And he said, we are going to be facing regulatory barriers for a while in terms of replacing clinicians, but the picture might be much easier to handle on the non-clinical side. So he issued an invitation to all the other executives, the executive leaders of his organization, to think about whether they could be replaced with AI. And that's what led to this title, the title of the article, Replace Yourself with AI. And if you look at the subtitle, it said, let's test out this new tech where the downside is a bad spreadsheet, not a missed cancer. He said the stakes are much lower at the organizational leadership level. And that is where the action might happen faster and in much more aggressive ways. And he said, we should take the leadership role. We should take the lead in terms of this discussion, because if we don't, others will decide for us. And please feel free to interrupt at any time. if you want to say something about anything of what you're going to be hearing next, because this is spreading and the writing on the wall is becoming clearer and clearer. You see, Meta and OpenAI and other companies are asking these questions constantly. And there have been interviews with the leaders of these organizations where they say the CEOs could be replaced. Yeah? We could be replaced. So this is starting to shake us. And the question is, within healthcare, how much are we playing a proactive role in these discussions? Really? And in a way that would not be purely defensive or dismissive, but seriously, to say, what do we need to protect at all costs on the human side, and take it as something much more important than just an exercise during a session like this to generate a word cloud. What is the role, or what are the roles of a leader that we need to protect at all costs, because it could not be done as well or better by a non-human advanced intelligence? And the faster we do it, the better, because there are now entrepreneurs who are taking this seriously. And companies are starting to emerge in which they are inviting groups of people to even start companies without CEOs, and to have that figure of the CEO as an avatar that could be programmed to fulfill certain roles and to support the team without human input. Pure AI play. What would be lost if that happens? Okay? And if we extend that to the C-suite of an organization, what is the role of a chief operating officer, and what of those elements do we need to protect at all costs? Because if a non-human intelligence does it, the outcome is worse. And how can we actually justify that? And even if it cannot happen now, we have an opportunity to simulate scenarios, even if it is only in our minds, to imagine how a non-human advanced intelligence could fulfill that role just as well, if not better, and to stress test each one of our assumptions. Because that's the biggest risk we have. We love humanity so much that we tend to underestimate the capacity of non-human intelligences to take over. Okay? So look at some of the boxes at the bottom. Replace your CEO now. Calculate the return on investment. And if you want a demo, just give us a call. And we'll build something like this for you. And they have been tongue-in-cheek, some of the examples from this organization. If you look at the text at the bottom, they say this CEO would not need to pretend to be compassionate, because we consider compassion in CEOs as a gimmick, pretty much. If we measure CEOs by what they do and not by what they say, the picture that emerges is a little different. And that may be a test that would be given to most of us. So each one of our strongly held, highly valued assumptions are up for grabs. And they are being stress tested in ways that we cannot even imagine now. But it's happening. And I'm wondering if there is an opportunity here to pause a little bit, if there are any reactions from the room about these two ends of the spectrum, and the pull of the non-human side to suck whatever we consider valuable for humans to protect and to preserve.
Just one sec, Alex.
Hi, my name is Nat. Wear a number of hats, but do a lot of public health communications, advising to public health departments. I'm curious about coordination, either coordination between AI CEOs, or are we increasingly seeing the role of coordination across team members across hierarchies in health? I'm not sure if anybody else in the room has this perspective, but I'm not sure that an AI CEO is the worst scenario if we have other cross-pollination, coordination networks that get set up across leadership structures?
Thank you very much for that question. I'm going to go to the public health side first, which is very close to my heart. I am one of 20 members of what is known as the Global Public Health Leadership Coalition. This is a group created by the World Federation of Public Health Associations right in the middle of the SARS, the acute episode, the acute component of the SARS pandemic. And it was created in response to a large extent to the absence of the public health community as leaders. We dropped the ball. We allowed politicians and media and other actors to control the agenda. And it was for me probably the biggest heartbreak of my career to see such a big opportunity missed. And now I am part of some groups that are thinking very carefully about replacing the entire public health staff. The entire. They say public health is up for grabs. If there is one area in healthcare that we could replace easily, almost end to end, is public health. No humans. They're useless. Yeah? This, for me, has been incredibly shocking, and I'm part of these kind of conversations, to the point that I was invited to present to all of the deans of faculties and schools of public health in Europe. And the question was, if public health disappeared, would anyone notice? Would anyone notice? So for you, I would like to start by saying, let's hold on to our assumptions, let's stress test them, because that is where it might start happening much faster than within healthcare organizations. Now, to the second, let's say, to the main component of your question, just having something like this, an AI CEO, is actually forcing us to think about what are the functions of a CEO that should be protected at all costs, and which ones could be done better by a machine. And the issue of coordination is a very important one, because they are not chief coordination officers. They are chief executive officers. And we are not paying attention to what we mean by execution at that level. Is the role mostly strategic and only strategic? What are the tactical and operational sides of a CEO? Is coordination even part of that? You see, and this is pretty distressing to most people in those positions. But I would like to argue that it would be as distressing if somebody came to us and say, justify your existence and justify anything that you do now, okay, in terms of the need to preserve it. And as clinicians, I'm a clinician and I work at the end of life. I have devoted my life to what I call the high tech, high touch, but how to protect the high touch with the high tech and from the high tech. And I used to say empathy. And now, boom, JAMA published a paper 2 years ago showing how very primitive LLMs and their double-blind conditions beat humans, clinicians, hands down in terms of empathy. Okay? So this is why not even compassion is secure and safe for us. So,
Alex, one more coming.
Yeah, good question. Great area to pay attention to and to consider it as a priority.
Hi, Alex. My name's Amy Lang. I'm an AMS Fitzgerald Fellow. I've worked most of my career in government, in the health sector. And building on the question, Natalie's questions and your response, I guess I love the thought experiment of getting rid of CEOs, and I also feel very skeptical of it. And the reason I feel skeptical of it, and because I'm trained as a social scientist, I often ask this question in health conversations, is that so much data that affect leadership decisions and that affect our health are not currently captured in our models, right? And as I think about my own leadership experiences and looking at other leaders and how they operate and where they're successful, it's actually their capacity to integrate tacit, non-digitized information, context, experience and intuition into their decision making that I think AI will have a real hard time capturing or replicating. So I'd love to hear your thoughts on that. Thank you.
And I'm with you. I am a philanthropist in the etymological sense of the word. I'm a lover of humanity. And this is why, and I sense it in you too, and in most of us, we would like to preserve humanity. So we are biased in favor of humanity. My call is to try to overcome that overweighting of the value of humanity so we can have more clarity in our thought experiments and we don't contaminate them by our propensity to consider humans so special. So these thought experiments in a way should be two-tailed, to stress test them on the side of pure AI, to stress test them on the side of the pure human, and to recognize that we would be, you see, more favorable towards the human. So now, to be more specific to your comment, governments are another target. Government infrastructure, human infrastructure for these aggressive groups from outside. Now there are calls to create corporate countries, you see, and to get rid of most leaders from the public sector, and to have humans on the corporate side with non-humans on the corporate side running society. So even the notion of the public sector is under threat. So so again, my call is to also invite us to have more humility in the sense that what we see now in terms of AIs is the worst it might be ever. So this is the worst we are seeing, and that there will be more models coming. LLMs is not the whole story. It may be just a small portion of the story. There will be other substrates, other models, other ways of doing things, and at some point, machines may display the same features of intuition. And when you say we don't use all of the data we have, well, then machines would not need to use all the data we have. And if they can fake intuition and get better results, I bet that if they are cheaper and faster, those in power will not blink to eliminate humans from the picture. So again, let's keep stress testing ourselves and our scenarios to be able as leaders to ensure that the right balance is achieved. And I hope I have addressed your question reasonably well.
Alex, we have a couple more people's hands up. Do you want to keep pushing? What do you want to? We're going to go till 2:30 with Alex. We've added more time. What do you want to do? You want to keep the conversation going, or you want to kind of get to the next?
I would like to use this as an opportunity to check how we are doing. Raise your hand if you are happy with how things are going. Okay.
In life.
Yeah, raise your hand if you are not happy with how things are going.
Are you guys okay? Raise your hand if you're okay with the vibe we're at. Yeah, everyone's pretty good.
No, hold on a second. Raise your hand if you are not. Okay, raise your hand if you have ever had a sexually transmitted disease. Okay, at least 30% of you have had at least one sexually transmitted disease. So I'm trying to figure out how valid your public displays of support are. Okay, so I would like to have some feedback as to how to improve what I'm trying to do here, which is my best. I'm trying to build a we and us at a distance of thousands of kilometers, hoping to illustrate just by the delivery using technology. This is a centaur approach. I think I'm in control with Zoom, which has a lot of AI in it, as a supportive player. So any feedback on how to improve this and to guide the answer to that question? Should I keep going, or should we give a space for those two additional questions at this point, or not? So again, why don't we do it together? Raise your hand if you think I should keep going. Raise your hand if you think we should entertain those two comments or questions now. Raise your hand if you're not sure, because it was about 70% response rate. Okay, great. So I think the majority rules. Let's hear those two comments or questions.
Lots of pressure. Alex, it's Sheena. You used to lecture me when I was doing my master's program. I spent a lot of my career at UHN, and I now work for a health tech vendor. I wonder how we can preserve humanity within a capitalistic society where the framework that we're operating in is all about making money, saving money for the bottom line. If we can automate as much as possible and it will save us money, then who actually cares about not doing that?
Sheena, thank you, and it's wonderful to see you. And I hope the lecturing did more good than harm. And I really look forward to seeing you in person again. Yes, we are not only in a capitalist system, we are in a late capitalist stage. And what we are seeing is what is called accelerationism. We are accelerating. Some people believe that we should press the accelerator and that we will be able to see the best picture possible by doing so. And I think it's safer to have a null hypothesis. And a null hypothesis I would pose is that there will be no roles for humans if those who are in power, financial and political, which are basically much the same, you see, they have a very strong super and between them. If they can see that it will be more advantageous from a financial perspective, we will see a very subservient role of humans left as the residue, and most of the activities controlled by non-human intelligences. So that's the null hypothesis, and it's down to us to reject it. Stop. And then I hope that's a satisfactory answer, Sheena.
She's nodding. Zaina stepped out of the room and then gave me the microphone, so I'll ask the next question. Hi, Alex. My name is Laura. I spent a lot of my time thinking about and studying human behavior in the context of leadership. But my question, actually, I'm going to shift to my individual experience and then try to read the room to see if it resonates. When we think about compassion, there's our intention and there's our impact. And so it's interesting to see that word cloud, and I suspect that everyone in the room would say, yes, I want those things. I want connection, empathy, I can't remember all the words, compassion, love. But it is one thing to intend to enact that, and another thing, there's such heterogeneity in how people experience compassion. And when you were talking about the different levels, I forget what they were, what I found myself coming back to is what about individually? Is there a role for us leveraging technology to be more compassionate with each other? I'm not articulating this well, let me try to say it in a single sentence. I can intend to be compassionate in every interaction I have. I'm finding that increasingly hard to do because of everything going on in the world and the experiences everyone is having. And so how do we, does that resonate with other people? I see people in the room nodding. We believe in it, but just one-on-one as leaders enacting compassion seems harder now than it did 5 years ago and 5 years before that. And just your thoughts or anything you can offer around, not even organizationally or team-wise, just person to person.
Yeah, and Laura, thank you for that. And by the way, I invited the group to give me feedback on how to make this a beautiful, memorable, repeatable experience. So please keep that in mind, group, because I would really value that. So I am part of another initiative called Compassionate Communities. I don't know if you're aware of it. Compassionate Communities. You may want to check them. There are compassionate cities, compassionate organizations. I have had the opportunity to work with them very closely, especially a group in Seville, Spain, led by the New Health Foundation. The New Health Foundation. Please check it, because they are making compassion the heart of everything they do. And we have gone to schools to see how we could have compassionate schools, and to households to see how we could have compassionate families, and then to organizations to see how we could nurture compassion. And what we are seeing, and this is instigated by Silicon Valley, by the bros from Silicon Valley mostly, is that both empathy and compassion are viewed now as weaknesses, not as strengths. And that is a very dark force coming upon us. Because to experience others' suffering and to be willing and able to do something about it in this world that is becoming increasingly individualistic and egoistical, it's getting harder and harder, to the point that a lot of the people who are working on ethics groups within major hyperscaling companies, AI companies, are being pushed out. They're regarded as wussies, as snowflakes. And I think that is infecting most of our organizations. I have been exposed to many C-suites within healthcare organizations, and compassion is pretty much absent. I spoke with the head of HR of a major Toronto institution, and I was sharing data about the suffering of the nurses. And we had really compelling data about what they were experiencing. And she said, what would you like us to do? To acknowledge it? We'll be in trouble. That was the reaction from the head of human resources at one of the biggest healthcare institutions in Canada. So there was an acknowledgement of the suffering and perhaps a desire to do something about it. But what was clear was that even at that level, it was very difficult for them to translate that understanding into meaningful action that would relieve that suffering with all the power they held in their hands. So thank you very much for that comment, Laura, and I hope my answer contributed. And again, as I said, it would be great to get feedback as to how to make the most of this session and to make it memorable, repeatable. Any ideas, any suggestions?
Oh, sorry, I actually had a previous question, if I can jump in, Alex. I'm Pedro. I'm a scientific associate at UHN and a current AMS fellow. I actually work with Quinn Pham and Joe Cafazzo, so I've heard a lot about you, and I probably wouldn't have my job if it wasn't for you, because you founded the place that I work in, so I'm very excited to meet you virtually. I guess my question is like, so we've been doing a lot of co-design with patients, and we've been showing them these bot prototypes, and we got a lot of pushback because people have been telling us our bots are very empathetic, and it feels very fake. It feels like we're talking to an HR person, and they really don't like that. So I understand that like the bottom line for the people on top is that if the AI does the job better or cheaper, they will not hesitate to replace it. But I think we may be seeing some resistance from the people on the ground who are actually like receiving care for these tools. So I guess my question is, if we assume that we got it right, so the M%, like human and AI, we got it right. We figured out what humans should do and what AI should do. I was just wondering for you, like in an idealistic vision of this, like what would that mean? What would it mean to get that right?
Okay, and that is exactly, and thank you, Pedro, for that. And I'm glad that the center still continues. It's 25 years now. It was funded by the Canada Foundation for Innovation. And I remember when I proposed it at UHN, they would say, is that science? Is that worthwhile? And they would call us the fluffy people. And I created a banner at some point saying, to the power of fluff, because UHN wanted to put a lot of money into regenerative medicine and that kind of things. And all this digital stuff, e-health, what the heck is that, they would say. And they would poke fun at me and Joe and others. And we submitted 4 proposals to the CFI at the time, and only one was funded, the one that led to the Center for Global Health Innovation. That was the name of the center at the time. And that's when the knife started to come out. And it was quite an interesting ride. So I'm really happy it's still thriving now under the 3rd generation of leaders. So, and I'm glad, Pedro, you are there. Anyway, I picked this comment at the bottom of this screen on purpose, because that seems to be what is transpiring to those in the trenches from the leaders of the organization. It's let's work them until they break, and then let's give them yoga classes or meditation classes or mental health days. And we need to recognize something else, is that we are going through the period, the era of financialization. When my grandfather was working as a physician, the world was very different. My dad was a physician too. And they would not believe what's happening now in the healthcare system, that we are just a branch of the financial sector. Most of the conversations have to do with money. And whatever contributes to the financial health of the organization would rule, even if the patients and the healthcare professionals pay the price. And I would say that clinicians and patients are the weakest link in the healthcare chain, the weakest links. And most of the price is being paid at the front lines. So that's probably what leadership is calling us to do. And I'm considering leadership as this living entity with which we could have conversations. So I'm going to push now, because what you were addressing, the question you asked was, if we get it right. And the point I'm trying to make is that it's not clear what it means to make it right. And it's down to us to decide what it means to get it right. Because we are the generation of leaders who saw the emergence of these creatures. We are the first generation that is coexisting with intelligent tools that are more than tools. And whatever we do or don't do will reverberate throughout every future generation until the last human stays alive. And they will look back at us and say, what did you do with that opportunity you had? What did you do with those challenges you were facing? So this is pretty serious, perhaps more serious than we think, because the future of humanity may be at stake here. So if we look at the center, or at the middle part of the spectrum, that's where humans and AIs now come together. And we have, on the one side, on the center, humans with AIs in the loop, and on the other, we have AIs with humans in the loop. And there is already stuff happening there. This is probably the best example of centaur healthcare leadership. This company called Heidi, which is being supported by major players like Oracle. I know how many of you know it. Raise your hand if you have seen this. Raise your hand if you haven't seen this. Raise your hand if you're not sure. It's like 15% response rate. Okay, so let's try again. How many of you have seen it? Okay, how many of you have not seen it? Great, we are close to 90%, I would say. Interesting for those who, how many of you are not sure? Okay, how many of you don't care? Okay, so this Heidi has identified 3 components to support leaders as centaurs. So comms, communications, transcribing things with ambient tools, and evidence to guide their decisions. Okay? And it'd be very interesting to see, because these platforms learn as they are used. And the risk that we have when we use AIs as centaurs is that the non-human side is learning ways to replace us. That's the subtext of most of these initiatives that are run by the private sector. And we have seen that migrate from the centaur to the minotaur end in front of our very eyes. And what's happening with Luigi Mangione, for example, is a clear example of that. It's a clear illustration of what happens when machines start to take more and more control over decisions that require leaders' oversight, and they are led to run wild in the pursuit of profit. So in the US, for example, most decisions about qualification for healthcare services or claims are made by AIs, and it's practically impossible for humans to override the decisions, because in most cases, these decisions are coming from the black box. And now there are countermeasures. There are groups of patients and clinicians who are developing new platforms with AIs to battle the minotaur created by the insurance companies. And we see this on a daily basis. If you go to the airport and you have a problem with your seat on a plane, and you talk to the human at the counter, I said, please, okay, I'm having this problem. They would check the computer, said, well, sorry, I cannot do anything. Why? Well, the system. And that's what we are hearing. You call it happened to me at the airport once. I was invited to go to Doha, and I changed my flight to go through New York from Toronto, Dubai, New York, Dubai, Doha. I arrived in London, and they said, you are out of sequence. We cannot give you your boarding pass to go to Dubai. I said, why? Because the system says that, but we can send you back to Toronto so you can come back at no cost to you, and then we'll give you the boarding pass to Dubai. And it took me 2 hours, and I almost missed the flight to try to persuade the human that what they were saying was crazy. And this is happening increasingly with algorithms controlling the decision-making process and humans in a very powerless position. Which takes us right to the middle of the spectrum. That theoretically beautiful spot where human and non-human intelligences can bring the best that they can offer and together achieve something that would be impossible by each of them separately. And what should be the key word to describe that secret ingredient that would make it possible and that would allow us to try to understand what is doing it right? Because the pressure will be constant to shift to the Minotaur or to the pure AI, to the detriment of our humanity. And this is where this little suffix becomes important. And this suffix, co, every time you say it, translate it into with, because that's what it means in Latin. It means with. So communication will be key. But this communication between humans and AIs as co-equals. I have trained AI agents to operate with me as partners. And the articles that were mentioned saying earlier when you introduced me have precisely to do with how far can we go in terms of having co-equal communication. We need to collaborate, and that means to work together. We need to consider each other as co-equals when we co-create, when we accompany each other, and when we, and this might be the hardest one, when we commit to each other. And that would be more and more evident as an important ingredient the closer we get to sentient, conscious, non-human intelligence. So we might want to pause here a little bit again, or go to another exercise to look at the entire spectrum and to look at it as sending signals to us from a new world that is opening in front of us, with opportunities and challenges within each of these buckets that in fact may be part of a continuum or something so diverse and so dynamic that even within a particular decision, we may need different positions in sequence or simultaneously.
All right, look, before we head to the next exercise, Vanessa here wanted to kind of get into the conversation a bit. Is that okay? It's linked to this. And then we'll keep going. We've got about 15 more minutes, Alex.
Okay, you said to the end is 20, but that's okay. I can do with 15.
Okay, well, 20, because we have long questions.
Hi, Alex. Thank you. This is Vanessa. I commented earlier on the value of really struggle that was mentioned. So my comment and my question is around what my colleague to the right of me said around the value of AI CEOs in terms of looking at collaboration and actually really looking at system integration. Right now, hospitals and community sectors, they're not using the same EMR. They don't even connect, because I think at the crux of this is we can't often get over ourselves. And that in essence is humanity. So how do we use that to our advantage? The sort of ugly part of our humanity in terms of having conversations, and if you can offer some insight in terms of how to have some of these conversations around collaboration, not particularly even on the highest echelon of leaders that are in the health system, but also on the front line, and even for the patients that we work with and for.
Yeah, thank you, Vanessa. And by the way, I didn't hear any feedback on how to improve what I'm doing. So Zaina and organizers of the meeting, if you get any negative feedback, it's shared responsibility. Okay? So don't take easily anybody who says he should have done this, because we had the opportunity for me to know that that person wanted me to do things differently. Okay? In a way, I'm exonerating myself from what happens in the next 20 minutes and what happened up to now, because we had the opportunity to give me feedback on how to optimize this experience.
Okay, you're crushing it. You're crushing it. Keep going.
Okay, so now to your question. I wrote a paper that may answer this, and it gave me the Paper of the Year award by the American Public Health Association in 2023. The title is Facing Leadership That Kills. Facing leadership that kills. I think that most people in positions of really powerful leadership are committing social murder. And this is a term I adopted from the current editor of the British Medical Journal. Look at what's happening geopolitically. We are committing social murder, either by action or by omission. Yeah? And I think one of the key components of leadership is courage. And we are not displaying courage from the healthcare system. We are showing a lot of cowardice. We are abdicating our responsibility. And if we believe in the notion of health in everything, which is a beautiful idea, we are a very sick species now. We are not adapting properly to the challenges we are facing. We are facing a polycrisis, which is in essence a crisis of coordination. And it manifests at all levels, even at the level of the EMRs. I remember, what was it, 20 years ago, we invested billions of dollars in the Canada Infoway budget. Billions. In Ontario, we have burned billions, gazillions. And we might be worse off now. And what we are doing is giving power to two companies, Epic and now is Oracle, whatever, and just a bunch of small ones to do with us whatever they want. And the least of their interest is to make the experience attractive for us and seamless. So all that fragmentation we are seeing with information systems reflects fragmentation, is fractal at all levels. Look at the United Nations, completely irrelevant. Yeah? So we have a big leadership challenge in front of us. And the question is, are we prepared to take it on? And I invite you to read my article, Facing Leadership That Kills. I said it all there. So now, let's go back to the Mentimeter. Look at this spectrum and think about and describe which position on that spectrum worries you most right now in your context, not in general, in the context in which you operate and work and live professionally. Okay, it seems to have stabilized here. Okay, should we consider this enough? Because I think it's pretty clear that what worries us most is the pull towards the non-human. Okay, so now let's see how it looks like on the other side of this coin. Which position on the spectrum excites you most? Let's move to the next one. Right now, in your context, excites you most right now. Oh, isn't this beautiful? How nice. You see, there is a dichotomy, pretty much. There is a bimodal distribution, which is by design. We are more excited about the human end of the spectrum or the co-equal. That is surprising to me in a beautiful, happy way, because it indicates that we are keen to peek deeper and deeper and deeper into this new space of possibilities. So let's give it 5 more seconds before we move to the next one. 4, 3, 2, 1. No more answers. Stabilize there. One more. Okay. Now, let's try to integrate those in a way with the next one, which is teaming with AI making you stronger, weaker, or are you not yet sure? Bravi. Nobody's feeling weaker. This is wonderful. Okay, one person. This is great. I think this speaks for itself. And what I would do is just proceed, and then if we think we should go back, or if somebody wants to say something about this, or about any of the other 2 patterns or responses, if anybody wants to say something.
Alex, we have a couple hands up. Is that okay?
Absolutely.
Okay, over here first. Introduce yourself.
Hi, Alex. This is Karine. I work at Ontario Health currently. A long time ago, I worked at St. Michael's Hospital, and I remember you presenting, and you're just as fabulous now. So thank you for this, really getting us thinking. I'm struck by the first exercise in thinking about what we want to preserve and the answers here around how, I guess, many people feel stronger, and yet I question whether we are accurately measuring those things we said we wanted to preserve, which is why I answered, I'm not sure yet, because I think there's a lot of unintended consequences that I'm not sure if we're actually monitoring for. Obviously, de-skilling is one of them, but some of the other elements we said we want to preserve, do we in any way measure for those? So that's just my comment.
Thank you for that observation, Corinne, and that is where I would like to take you. So thank you, because you served it beautifully.
Do we have time for 2 more hands up, or do you want to keep going and then they come back at the end? Can we do 2? How about we do 2 quick, like tell him the 2 things, and then you can decide, Alex, how to integrate and land the airplane.
And I am leaving it. I don't know if you can see these, or leave the slides as they are there. Don't switch yet to my presentation because that may relate to the two questions. And by the way, I am weaving the questions. There is not going to be a special Q&A section. Okay, so if you have questions, let's make the most of the next 10 minutes to weave them into what will happen.
It's Sheena again, Alex. And if you go back one slide to what we're most excited about, I was just struck, we're all kind of in the middle towards the humans. I think it's like a function of who you have in the room. I worry about what this looks like for like a group of like CEOs of tech companies right now and where they might pin their spots.
Okay, I'm coming over to Emily. 1 second.
Hi, Alex. It's Emily Cito here, back from the center
Hey.
many years ago. It's great to see you. I guess my question here is a bit of worry about how we are educating and training our next generation and what I should be teaching my kids even. Like, I don't know what skills to do now, right? And so this is where I get excited about that middle ground, and I get fearful when we're getting kind of closer to pure AI, but I'm hoping there's still a role for our trainees. And I'm kind of wondering what you're thinking of in terms of how do we want them to still critically think in this age of AI? And what should we really be teaching them at this point?
Yeah, and Emily, I'm so happy to hear your voice and to see you a little bit. We built a center. You built a center. You were one of the OGs in there. So on behalf of what is happening now, thank you for that. And you guided us in terms of how to handle images, which was very tricky at the time, continues to be tricky. Anyway, so I would like to switch to my presentation because I think that would contribute to answering the last three questions. We might be in a situation similar to those European explorers who decided to go on a ship westward, and the maps of the time would call whatever would happen on the left side of the spectrum of the map terra incognita, because we don't know. And what we may need to do for our children too, for the next generation of leaders and for ourselves, is to become more comfortable with what could be called how not to know in the best possible way. How not to know in the best possible way, to the point that we would actually embrace uncertainty. We tend to fight against uncertainty. And it's probably the only inevitable thing that we're going to face. We don't know, we will not know. Well, how can we not know in the best possible way? How can we minimize regret associated with any of the decisions that we make, including not deciding? Okay? And this is why simulated scenarios, hypothetical cases, thought experiments become more and more and more important, and conversation. And to understand that regret is the biggest risk, to create regret. So we can anticipate the sources of regret. I think I have done it as a palliative care physician most of my life, by imagining the worst possible scenarios, the best possible scenarios, and then to figure out ways in which we could maximize the likelihood of the desired scenarios to happen, and to turn into successes, ideally, the worst possible scenarios. And Emily, if you remember, one of the main motivations for the creation of the center was how to make change attractive, which is one of the things we resist most. So we built a very flexible place where misfits could fit, like a sandbox where we could simulate even our most horrifying scenarios, and then put in place mechanisms to ensure that if the worst possible scenario happened, we were prepared for them. Okay? And on top of that, we need to build layers to be able to absorb the unexpected, the things that we cannot even imagine. And I think that is what this next section is going to contribute, because what you have described in your questions illustrates the new challenges that are emerging. So the first one I would like to show is that we are facing a new type of teams. And these teams are heterogeneous. And if we had heterogeneous teams with humans, even though we made efforts to homogenize people like the nurses, the physicians, you understand, the this or the that with labels, we always knew that it was impossible to do. But now it's going to be harder because we are going to have humans with very heterogeneous natures, non-human intelligences that will be increasingly heterogeneous in highly heterogeneous relationships. And as leaders, we would need to enable them to operate as teams. So this is a big, big challenge. Again, Emily, for you as a mother, and I remember you as a not mother and even pregnant, you gave me beautiful memories. You brought back to my mind the image of you beautifully pregnant at the time. And even with our children, you see, and the relationship with AIs, they will be teaming with them and we'll be teaming with our children and with the AIs that will be increasingly present in our lives. So this is happening in all areas of our lives. And that will force us to think of adaptability in a completely different way. I wrote a book titled Healthy No Matter What with my youngest daughter, Tamen, about 3 years ago. And we view health there as the ability to adapt. And then we had to answer the question, what do we mean by adaptability? And we searched a lot of the literature and proposed to view adaptability as a capacity, the capacity to change in response to the inevitable challenges that we face in life. And here's the kicker, and get stronger, get stronger. And this is different from resilience. Resilience is a type of adaptability, if anything, because it means changing in response to a challenge and then return to your baseline. Okay? But we can adapt to a point in which we become something else. And that's what evolution does. But in this case, we will need to co-adapt. We would need to change in response to challenges and become stronger, but with a big we, as part of these heterogeneous teams. And that would be new opportunities for us as leaders to learn, and new opportunities for us to teach and to share these insights, not only with human leaders, but with non-human leaders that will be emerging more and more. And that will also create challenges for our notion of compassion, because we'll need to think of compassion as a hybrid concept that is not exclusively human. And I feel this hybrid compassion every time I have to call a call center and I have this poor person, usually in the Philippines or in Bangladesh, trying to solve a problem at the mercy of an algorithm that has been designed by people who don't give a hoot about them. And I can feel the pain of this person trying to do their best to support me. And all I can do is to acknowledge our limitations there together. And that, in a way, for me, has been the biggest source of what might be happening more and more when our combination, our co-equal teams, are generating sources of suffering for us as members of the team or for those who are affected by the teams that would require a completely different way of approaching the challenges compassionately, because it would require that hybrid component. And lastly, if we think about all these things seriously, we might be already a different species. And we might have not recognized it yet. You see, all our technologies have changed us throughout our history as a species, since we became Homo sapiens sapiens. And we have changed our tools, always. So we have been always working as part of an entity that has two components. But as it happened with bacteria and mitochondria, when the mitochondria and the bacteria decided to become one new entity, that became an eukaryotic cell that led to us. And that is known as symbiogenesis. It's when two entities merge, combine, and turn into a new entity, ideally with new strengths and with new capabilities. And we might already be at that stage, and we might have been at that stage since the beginning of our digital age, when we started to use these tools as part of our lives. So these new challenges, I think, should be very important for us as we move into the future. And perhaps the most important one is to recognize the difference between being managers, I'm finishing now, and being leaders. And we tend to conflate the two things. Manager is a term that comes from Latin too, and it comes from manus, hand. Is the strong hand that is needed to tame horses. And this is what we see in most of the behavior of most leaders in the healthcare system. It's all about coercion. It's all about rules and regulations and enforcement, intimidation, consequences. Leadership comes from a word that dates back probably to the 14th century, that hasn't changed. To lead is to travel. Leadership involves traveling in the same direction. It means to be able to seduce, to be able to persuade, to be at the front, even if it is to serve from the front, and to enable people and non-people, you see, non-human people, as the non-human intelligence we would have to lead increasingly, to keep the course, especially when things get difficult. And this will be the biggest challenge for us as we are moving continuously into this new era. So I would like to end by saying that a new kind of leader is needed, and that we don't know what that leadership would entail. We can just sense it, and that it's okay not to know if we are prepared to figure out how not to know in the best possible way. And this is my final question. Are you becoming one? Are you becoming one of these new kinds of leaders that we need so much? And how can we tell? Thank you very much.
Brilliant. I think there's a conversation in the AMS community that needs to jump off of from Alex's presentation, and over the coming weeks and months, I imagine that we will have more conversations about leadership. I immediately dug out some work that I was exposed to from Ivy about leadership character and the complexity of leadership going forward, and we had a good treatise on that from Tim Rutledge yesterday, but this has been absolutely excellent. And I thank you deeply for being so provocative and for really making us think and for laying out the challenges ahead of us, even if there is a lot of ambiguity, and there is. I think we've got some thinking to do about what kind of leadership competencies we need and how we're going to develop them and how this community is going to lead through the challenges and get us to the place. Looks like most of us are thinking that the co-design and the partnership is the way to go, but we got a lot to learn about how to do that. So thank you.
And thank you for the opportunity to be here again. I hope English, like Spanish or Italian, had a term to express gratitude for what is possible only by achieving it together. And thank you is you see, one-way kind of thing. Yes. So you said thank you, I'm saying thank you back. I wish we had that word that could encapsulate what I'm feeling now. Gratitude for something that happened only because we made it happen.
I feel the same gratitude. Thank you again. All right.
Big virtual hug.
Group hug. Group hug. All right. Ms. Zaina, we're good? We're good? I just, I want to thank everybody, including my team and everybody who's been here for the last couple of days. I think it's been magnificent. I think what I'm struck by is a bit what Alex was saying is, when I looked just briefly at the debate yesterday, and, there's a lot of 70-30s, 50-50s, 60-40s in that, and it said to me that there isn't necessarily agreement on the path forward. And that, and a lot of ambiguity in what that path forward is actually going to look like. And I think that is an opportunity to lead and to create and to get out ahead and to think. And so really, as we think about the people in this room and what we have ahead of us, and I was just at an event, some of you may have been there, Health Excellence Canada, like no regret moves. What are the things that we're going to do over the next couple of years together that are going to put us in a good place regardless of, whatever the alternative futures are. So lots of work ahead of us, lots of confidence in the brains and drive and leadership and character of the people in the room. And I thank you very much. I thank my team again, and I really hope that you have a safe trip home.
Just give us hard input in the evaluation.
Yeah, absolutely. There's a lot of effort that goes into this, and so we want to get it right or better and improve every time. So please give us some feedback, and we take it to heart. We look at it. We actually take it to our board, and as we think about, what kind of programming and opportunities we want to create for you, it matters. So thank you. Yay.